Hi YouTube family, Redhead Middle Diva here, reducing red, sharing with you my week 31 post-op VSG surgery update. Numbers real quick. Highest weight to 38.6. Day of surgery 229, I'm remembering. Last week I was 150.4, this week I'm 150.2. Was able to go to the gym once, spent a very short time there. Obviously I've lost my stamina for the gym, not going. It's no longer June and July, a little two top on. But news. Very little gym, obviously. I don't think that the 20 minutes I was at the gym accounts for the 0.2 pounds I lost, just coincidence. Migraines and medications. Back up with the constant migraines again. On Friday night I did start to have arrhythmia from the doxepin. I had taken nortriptyline in the past for chronic migraine and did have heart issues where I would just be sitting still and my heart would go from normal to really, really slow and hard, and then it would go to really fast and then it would just kind of go away. And while it didn't hurt, I wasn't short of breath, you know, nothing like that. It's pretty scary, pretty funky. So Friday night, my husband had gone to bed and I was up just watching some TV because I wasn't tired yet. And, well, let's rewind. I came home early on Thursday because of a migraine and then took Friday off because of that same migraine, because I knew it was going to be slow and I would probably only have about a half a day's work anyways. So it kind of worked out that I was able to kind of rest and recuperate. Anyways, so Friday night, I'm sitting watching some television after my husband went to sleep, and just while sitting there, you know, midnight or something, my heart just all of a sudden goes boom, boom, boom. So less than 30 beats a minute, or around there, and very, very intense, you know, strong pumps. So it's really scary because do I need to breathe differently? Do I need to do something, get up and move? No, it was like that for probably 2 minutes. So that night I did not take the doxepin, and I didn't take it last night either. But last night after my husband's play, we went out, and while sitting and talking, it started again. So obviously it took, you know, 3 weeks, 4 weeks to fully get into my system. So as I thought it was starting to possibly help a little bit, I got the arrhythmia. So I'm not taking that anymore, and I'm stopping one of the pain meds because it really doesn't seem to be decreasing my pain enough to not take, you know, Excedrin and the liquid Advil. And you know, when you're in need of something, you want to take something that's going to relieve it right then. But I was kind of concerned about the amount of non-steroidal anti-inflammatory medications that I was taking all at once. So since I really wasn't feeling a whole lot of constant relief from the meloxicam, I stopped taking that as well. So I will see my pain doctor tomorrow and kind of let him know what's going on, and hopefully he'll be able to get me in this week for you know, an epidural shot or 2 or 3, whatever he sees from the MRI is necessary. So fingers crossed. Yes. So last week I had mentioned that some of my OCDs were resurfacing. You know, lots of counting, the cleaning, which I never do, you know, and the picking at my skin. So it was really hard. You know, about 1.5 years ago I started having panic attacks, and I had never had them before. My mother suffers from them often. So I was quite disturbed when I started having them. I didn't even know what the first one was, but it lasted like 2 days. but my therapist said I need to find a psychiatrist to adjust my medications. I couldn't get into any psychologist that took my insurance for over 7 months, and I was like, I can't really do the panic attacks for 7 more months. So I went to this, it's a behavioral health management kind of thing, but it's a whole building. There's several around town, and I found a psychiatric nurse practitioner who could see me and, has been overseeing my medications and, adjusting as needed and things like that. And it's fine, but because of the type of place it is, it's also like state subsidized. So there's a lot of jobless people, some with, physical or mental disabilities, most, recovering drug addicts, homeless people, kind of that sort of thing. So I always get a heightened anxiety waiting for my appointment, just looking around at what mental illness does. And it's just kind of, I'm not good with lots of people anyways, but make them all that type of people, super choice, and my anxiety gets worse. Anyways, it's been, manageable, but, I had mentioned I wasn't sure if the upcrop in my OCD issues was due to combining the medications that my pain doctor had given me with my regular anxiety medications. I didn't know if they were having trouble with one another, and so my medications weren't as effective, or if it was just the stress of all the migraines. Who knows? So I wanted to talk to her. Had to wait a while because I didn't have a scheduled appointment, but I had made several phone calls, and one of the last phone calls said, well, once we do talk to her, you will have to come in. So since I took some time off on Thursday, I just headed over there and waited, and I had to first talk with a on-call case manager to see if I was worthy of speaking to the nurse triage, and that took a while, and I spoke with her, and I just said, I'm wondering if my medications are interacting, if I need to stop any of them, increase any of them, decrease any of them. I just want to know because this isn't normal. Should I be watching for other triggers? So she says, okay, I'm going to give this to, the nurse triage, and she'll pull you back when she has a moment. And that was a long time. So the nurse pulls me back, and I explained to her what's going on. It's not a huge deal. I just have a question. I'm letting them know that there are early signs of my anxiety increasing, and I want to know if it's due to the new medications, if there's any kind of interaction that's making my current medications not work as well, or if I need to be more aware of reducing stress or what have you. And so, she asked me what kind of things are going on, and, I told her about the cleaning, and she's like, oh, well, everyone gets fed up and has to clean their house. And I'm like, not me. I don't get fed up. And then, when I mentioned the counting, like the constant counting, the distracting counting, how many times I'm chewing, the steps I'm taking, counting the keys that I'm typing at work, to the point where I forget what I'm typing. And she's like, oh, everybody does that. I count, that's not an OCD. And I'm like, I'm just telling you what my personal triggers are, and that this is not normal for me. Baseline, normal, getting along with medications, this is not correct. And she's like, I find I count when I want to be distracted, so you probably just want to be distracted from something. And I'm like, that could possibly be, but it doesn't normally happen. And then I told her about picking at my skin, and she's like, oh, well, what kind of picking? Self-destructive? Are you thinking about hurting yourself? I'm like, no, I'm just having an increase in picking at my skin. Oh, well, do you have marks? yes, I have marks. I don't really want to show anybody, but I showed her my legs. And then she's like, okay, well, I'm going to talk to your psychiatric nurse practitioner. She's just next door. I think I can, get a couple words in with her real quick. I'll send you back out to the lobby, and if she needs to see you, I'll pull you back. I'm like, okay, thank you. So I went back out in the lobby. There was like a group starting, so there were just an abundance of people I didn't really want to be around. And then she calls me and she says, I just need to talk to you real quick, and just right there, like in front of everybody, she's saying, there's no, she checked, there's no life-threatening interactions between these drugs here. And I'm like, no, duh, there's no life-threatening interaction between them. I've been taking them for a month, and I'm not dead. And I know that the pharmacist would not have given me them. That's not my question at all. And she's like, and there really isn't a reason that these medications should be causing you, issues. But if it gets worse, let us know. And I said, okay, well, my appointment's on September 5th. I'll see her then unless I need to come back. And then I start to walk away, and she actually physically grabs me, and she's like, well, if the picking gets worse and you find that you're digging and bleeding and, you need to call us. And I'm like, that is what my picking is. I showed you. I was bleeding. There's scabs. Anyways, so I left, and I'm just trying to stay calm, because it's obviously not a medication thing, and if it was, I'm stopping the medications anyways. So that was a whole lot of fun. My migraines that I've been waking up with are a little bit worse. I'm just kind of going through the cycle, I think, again, until it gets to the point where I need to have a bunch of lidocaine injections, and then it'll stop, and I'll just start up again. But hopefully my pain doctor tomorrow will have some sort of plan or solution. And I do have my breast reduction in less than 4 weeks, so that is very exciting. That will help. And I spoke with one of my husband's friends who is a massage therapist. I spoke with her in, a moderate amount of detail about what I'm eating and what I'm going through and my limitations and why I don't get massages and things like that. And she seems to know a lot about different things. And she said that we could try stretching. She does really good with necks and cranial work, so I'm going to try that and see if that doesn't help a little bit. I know that I will probably need professional stretching, in conjunction with the physical therapy to get the curve back, so that's my plan for now. So I will see you guys in 1 week. Thanks for tuning in again to listen to my misery. But I will see you next week for week 32, 1 week closer to breast reduction, and hopefully we'll have a plan with my pain doctor. Happy August to all. I'll see you next week. Thanks, guys. Bye.